Welcome, Professor Rich R in here. Do you struggle with lab exam questions, whether that be on ATI, HESI, or Kaplan questions? Don't worry, I got you. We'll go through a few here today, and I'll help you get ready to succeed in your next test. All right, here we go. Our first question. A client with atrial fibrillation, also known as AFib, is receiving maintenance therapy of warfarin sodium, Coumadin. So we have PT of 35 seconds. On the basis of these laboratory values, the nurse anticipates which prescription? A, adding the dose of heparin sodium. B, holding the next dose of warfarin. 3, or D, or C, increasing the next dose of warfarin. Or 4, administering the next dose of warfarin. Okay? So for this question, you want to focus on the client. So we know they have AFib, they're getting an anticoagulant. For this one, we need to know which lab test we're going to check, PT and INR. INR should be between 2 to 3 for therapeutic level for anticoagulants, but it's not asking us about INR, it's asking us about PT. So we have to know the normal lab values here. So about 10 to 12 is the normal lab value for PT. So the correct answer is number 2. For this question. So we're going to hold the next dose of warfarin because they're at increased risk of bleeding because that PT is 35, right? So therefore, we wouldn't do anything with increase their prescription because it's too high. We need to move that down before we would administer this to the patient. So of course, again, the answer is B, or number 2, we are going to hold this medication. Okay, so our second question, a client has been admitted to the hospital for gastroenteritis and dehydration. The nurse determines the client received adequate volume replacement if the blood urine nitre, also known as the BUN, level drops to which value? 1, 3 milligrams per deciliter, 2, 15 milligrams per deciliter, 3, 29 milligrams per deciliter, or 4, 35 milligrams per deciliter. So this question, we're focusing on the BUN. So you have to know that the BUN is specific for which organ. It's going to be the kidney, okay? So you have your kidney labs, which are creatinine and the BUN. The creatinine is really going to tell us how the kidney is functioning. The BUN is going to tell us how the kidney is functioning, but also can key us in on the hydration status of our patient, and that's what this question is asking us, right? So we know that they're in for dehydration. So we have to know the normal values of your BUN, which is going to fall between 10 and 20. So if that is your normal range and we're looking at our answers and we're trying to determine how many or which value is going to state that they have adequate fluid replacement, okay? So of course, the correct answer is going to be 2, number 2 on this one, 15 milligrams, because that falls in the normal range of the lab values of 10 to 20. 29 and 35 milligrams per deciliter is going to demonstrate to us that that patient per their BUN is still showing some signs of dehydration. 3 milligrams, although you might think the lower number is going to be better, that is going to reflect a abnormal value. Again, it's going to be greater than or lower than the normal range, which may actually occur or alert us that they have fluid volume overload. Okay, so we're looking for the one that is within that normal range, and the only one that is within that normal range is, of course, answer 2. Okay, so your next question here is the nurse is explaining to the appropriate methods of measuring an accurate temperature to an assisted personnel. Which method, if noted by the assisted personnel, is the appropriate method indicated the need for further teaching? 1, taking a rectal temperature for a client who has undergone nasal surgery. 2, taking an oral temperature for a client with a cough and nasal congestion. 3, taking an auxiliary temperature for a client who has just consumed hot coffee. Number 4, taking temperature on the neck behind the ear using an electronic device for a client who is diaphoretic. Okay, so again, we're looking for a negative action within these answers. When would we step in as a nurse and provide further teaching to our assistive personnel? So, number 1, taking a rectal temperature for a client who has undergone nasal surgery. Well, that's not the ideal position to take a temperature because we hopefully take it under their arm or auxiliary, but we definitely wouldn't want to put it in their nose. So that one's probably okay. 2, taking an oral temperature of a client who has a cough and nasal congestion. Now think about this one. negative effects and our ABCs, always airway, breathing, circulation, if we put that thermometer in their mouth and they're congested, they can't breathe through their nose, is that going to cause a negative consequence? Yes. Is it going to cause difficulty breathing? Yes. Is that one of our ABCs? Yes. So likely that's going to be our correct answer. So let's number 2, because involving airway, breathing, negative action. 3, taking the auxiliary temperature for a client who has just consumed hot coffee. Well, if we put that in the mouth, it's going to get higher than normal temperature. So that's the correct action. So we're not worried about number 3. So number 4, taking the temperature on the neck behind the ear using an electronic device for a patient who is diaphoretic. Fair. That one sounds like a good idea. So the one that we're really going to be worried about is that breathing one. So number 2 is your correct answer in this situation. Okay, here we have another question involving anticoagulant drugs, specifically heparin in this one. So earlier we talked about Coumadin or warfarin, which we check PT, INR. Heparin, on the other hand, you need to know that you need to check PTT, and that's what this question is going to involve. So that's a tip before we even start this question. So a client is receiving continuous intravenous infusion of heparin sodium to treat a DVT, or deep vein thrombosis. The client's activated partial thrombosis plastin time, APT, is 65 seconds. The nurse anticipates that which action is going to be required. 1, discontinuing the heparin infusion. 2, increasing the rate of the heparin infusion. 3, decreasing the rate of the heparin infusion. 4, leaving the rate of the heparin infusion as is. Okay, so this one's going to require us to know that APTT value. So the normal is going to be between 30 and 40, all right? Depending on, your facility and what they're using, but 30 and 40 is kind of where we need to be. So for someone who is on heparin for treatment such as DVT, we need their values to be anywhere from 1.5 to 2.5 times these normal values, which puts us in a range from about 45 to 100, okay? So we need them to be in that therapeutic range for what we're doing. So we gotta look at our question again. So 65, okay? Where is that in the range? Well, it's right in that therapeutic range, okay? So 45 to 100, 65 is basically right in the middle, right where we need it to be. So now let's look at our answers. Would we discontinue the heparin? No, because it's in therapeutic range. So 1 is gone. 2, increase the rate of heparin infusion. No, we don't want to increase the risk of bleeding, so that's wrong. 3, decreasing the rate of the heparin infusion. Absolutely not. It's in the therapeutic range already. 4, leaving the rate of the infusion as is. Yes, that is the correct one right there, because it's already in that therapeutic range of about 45 to 100. Always follow your policies and procedures and your protocols of your heparin protocol when infusing this, but that's the gist of how this works, is you want to keep it in that therapeutic range. All right, for this one, we're going to be looking at a drug, furosemide. So here we have a patient who has heart failure and is due for their morning dose of furosemide, also known as Lasix, the common name. Which serum potassium level, if noted in the client's laboratory report, should be reported before administering the dose of furosemide? So first, let's focus on test-taking strategies. What do we need to know here? Well, it's a lab value, so we got to know the normal values of potassium, right? That's obviously very important here. So 3.5 to 5, that's potassium, okay? Well, why is that important? What are they trying to tell us here? Okay, furosemide, what is that? Lasix, furosemide, Lasix, what does it do? It's a diuretic. They're going to diurese fluid, okay? They're going to lose fluid. Is it potassium sparing or non-potassium sparing? That you need to know. Hopefully you've said potassium non-sparing, which means when you take furosemide, you're going to lose potassium. So now with that in mind, let's look at what again are we looking for here? We always check our potassium before we give Lasix. Why? Because it's non-potassium sparing. They're going to lose it. So if they're low, we're going to put them at risk for heart arrhythmias. So again, which one of these are we going to be worried about? Okay. So the one that falls outside of that range, okay, so if we're looking at these answers, right, there appears to be some sort of typo on number 3. If the 2 MEQs equals 4.2, that's not exactly correct, but we want to look on that right-hand side where we have 3.2 milliliters per mole, 3.8, 4.2, 4.8. So those are the ones that I want you to focus on when we're looking at this question, those answers. So which one of those falls outside of that range? Okay. Of course, it's number 1, 3.2. I know you all got that one right. Way to go. Way to go. We're learning, right? So 3.2. So number 1 is the one that we would be like, it's out of range. Let me call the doc and tell them we have low potassium. Often they're going to give you some potassium replacement to administer along with this medication. Okay, so that's how that works.